You've probably noticed it, right? We're in the middle of this huge cultural shift around mental health. People are talking about it, awareness is through the roof, and the old stigmas are finally starting to crumble. But here's the thing. At the exact same moment, the system that's supposed to help seems to be completely overwhelmed. So in this explainer, we're going to dig into that paradox. Why is it that the more we ask for mental health care, the harder it seems to be to find?
All right, to really get this, we've got to start with the generation that's basically leading the charge here, Gen Z. Their whole approach is changing the game for mental wellness.
I mean, just look at these numbers. It's not just the stats, it's the story they're telling us. 37% of Gen Z is in therapy. That's not just a little bump, that's a massive seismic shift. They're making it totally clear that taking care of your mental health isn't some extra luxury, it's just healthcare, period.
But, and this is a big but, this is where the paradox really kicks in. Despite being so proactive, a staggering 61% of Gen Z has been medically diagnosed with anxiety. So you have this bizarre split screen. On one side, you have more openness and more people seeking help than ever. And on the other, you have these record-breaking levels of distress. What is going on?
Well, a giant piece of this puzzle is the world Gen Z grew up in. You know, the digital world. Social media is the ultimate double-edged sword here. Yeah, it can be an amazing place to find your people and feel less alone. But the flip side is brutal. It's this non-stop engine for comparing your life to everyone else's highlight reel. And it's designed to keep you hooked. So that brings us right to the core question of this whole explainer. We have a generation that is ready and willing to get help. So why does it feel like the system they're turning to is just not ready for them? Let's unpack that.
To really understand why things are so broken, we have to rewind a bit. We need to talk about this one huge law that was supposed to fix everything.
The idea behind the Mental Health Parity Act was actually pretty beautiful and honestly revolutionary. It said that insurance companies have to cover mental health care the same way they cover physical health care. So a broken mind should be treated no differently than a broken leg. Simple, right?
But here we are, over a decade later, and the reality is pretty sobering. When you look at the data, study after study shows the law just hasn't really moved the needle. That big promise of equality, for millions of people, it's still just a promise.
Okay, so we have the law on the books. Why isn't it working? Let's get into the nitty-gritty of why enforcing this thing is so incredibly hard.
When researchers talk to the people on the front lines, the regulators and the advocates, they hear the same three things over and over again. The rules are just way too complex, there's no real political will to make it a top priority, and sometimes the people who are supposed to be the referees seem a little too friendly with one of the teams.
A huge chunk of that complexity hides behind this one little acronym, NQTL. It stands for Non-Quantitative Treatment Limitation. The easiest way to think about these are as hidden rules or secret hurdles. They're not about money, like a copay. They're about making it a bureaucratic nightmare to actually get the care you're paying for. And this quote from an insurance official in Rhode Island just nails the problem. How are you supposed to prove that a rule for getting therapy is unfair compared to a rule for getting, say, physical therapy? It's like comparing apples and oranges. It makes proving that an insurance company is breaking the law almost impossible.
So what does this actually look like for you? Well, it's things like your insurance company demanding you get their permission before every single therapy session, or them having a much tougher definition of medically necessary for your anxiety treatment than for your heart condition. It's all these subtle little trapdoors that deny you care.
And here's the other problem. Even if you can spot one of these violations, the will to actually fight it can be pretty weak. This advocate in Massachusetts puts it bluntly. It can feel like the state regulators are a bit too cozy with the insurance companies. It's a classic case of what's called regulatory capture. When these modern laws and policies fail, the fallout is devastating. But it's important to remember this isn't happening in a vacuum. It's part of a much longer and frankly tragic history of neglecting our most vulnerable. See, for the past 50, 60 years, the big idea was to move people out of those huge state hospitals and back into their communities. The plan was to create this amazing network of local care to support them. But the money for that care never really showed up. So we ended up with this giant hole in the system, creating what experts call a revolving door for people with severe mental illness, bouncing between ERs, jails, and the streets.
This phrase is just haunting. It was coined way back in 1973. And it describes this terrible, unintended consequence of laws that were meant to protect people's freedom. The goal was to stop people from being wrongfully hospitalized, which is a noble goal. But for some, it's meant that people who are too sick to even know they need help are left without the care that could literally save their lives.
So you have all these different problems: weak laws, no funding, giant gaps in the system. But what's the one thing that connects them all? What's the real root of the problem here? When you boil it all down, it comes down to one word: stigma. For centuries, our society has treated illnesses of the mind and the body in completely different ways. If you get a physical illness, it's seen as bad luck, a misfortune. But for so long, mental illness has been viewed as a character flaw, a personal weakness. And don't think this is some kind of ancient history. A survey from as recently as 1992 found that 43% of Americans believe depression was a personal failing, not a real health problem. And while things are getting better, the legacy of that kind of thinking is still baked into the DNA of our healthcare system. And here's the real domino effect of that stigma. When a society sees a whole category of illness as a weakness, it just doesn't get prioritized. The research doesn't get funded. The politicians don't feel any urgency. The collective will to really, truly build a system that works for everyone, it just evaporates. And that brings us right back to where we started. We have a new generation coming into adulthood, and they're staring down this deeply flawed system that was built on a foundation of old ideas. This is the real clash of our time, isn't it? We have a healthcare system that was built for an era that saw mental illness as a moral feeling, and that system is now colliding head-on with a generation that completely rejects that idea and is demanding care as a basic human right.
Look, Gen Z has done its part. They've changed the conversation, full stop. The real question now is whether our institutions, our policies, and our priorities are finally going to catch up. What's it going to take to build a system that doesn't just promise care, but actually delivers it?